Assalamualaikum guys and good morning. Today going to give a lecture on I'm sorry guys. Okay guys, so my lecture today is on about radiation protection legislations. I think I've given you this lecture before, but why not I give it one more time? Okay, so basically we need to protect ourselves from the radiation, because besides good things, it also gives us some bad things as well. It gives you cells ionization and can cause cell mutations. So we have to protect ourselves, like we protect ourselves from COVID-19, right? So before we start, please subscribe my channel, okay? Press the bells button to make sure you will get updated with all my new videos, okay? Yeah. Okay, we come back to our slides. And first of all, as I mentioned earlier in my introduction video, we need some kind of protections from X-ray radiations. I know X-ray has many use, especially in the medical fields, but if it is used excessively, it's very harmful. It will give a very bad effect, not only on the, especially in the long term, but in the short term as well. Okay, so what kind of protection they have available nowadays? I will cover that in my following slide. Okay, so we need protections to protect ourselves, not only ourselves, but also to protect our patients, our friends, and those who are waiting outside in the waiting room. Okay, no doubt X-ray help us in disease management. For example, like for detection of fracture site in the face, okay, following a road traffic accident, or to detect the extension of bone tumor, for example in the mandible or in the maxilla. Okay, because those kind of thing, without exposing, without cutting the skin, we won't able to see the extensions or the location of the problematic area. So if you can see, there are two pictures. On the right, it's the MRI. MRI doesn't use any radiation at all. It works mainly on the electromagnetic principles. Okay, MRI is usually used for problem relating to the soft tissues. For example, let's say we want to know, because you can see MRI, you can see mainly the soft tissues. Okay, all the plants, the ventricles, or even the globe. Okay, so let's say a patient has intracranial bleeding, you can see some sort of darkening area. Okay, so for neurosurgeon to evacuate the hematoma inside the cranium, we have to look at the whereabouts of the hematoma first, so that we can retrieve successfully, or we can suck out all the hematoma successfully. Okay, so on the left side you can see a cellogram. For the MRI, it's just straightforward. You just ask patient to lie down, put in the MRI tunnel and switch the machine on, and that's it. Just look at the monitor, we'll see the result. But for cellogram, you have to inject some kind of contrast. Okay, wait for a few minutes or maybe a few seconds, and then we'll take the imaging based on contrast. Okay, usually for cellogram, we want to detect the location of the block duct. Okay, we want to know where the calculus is. Okay, so radiation comes from many sources, such for example like from the background. Okay, not only from the radiation source, the one that we usually always hear. Okay, come from the decaying molecule. Okay, it also can comes from our backgrounds, like while you are sitting in a room. Okay, you are experiencing some radiation as well. It's known as background radiation, but it is usually not harmful. Okay, so why radiation occur? Because some molecules are very unstable. okay, will undergo a decaying process and will produce or will emit some particles or wave. It's called as radiations. Okay, it is called radiations. We cannot run away from that. Okay, so for radiation can be divided into non-ionizing or ionizing. Okay, non-ionizing is a good radiations. Okay, it doesn't cause any cells damage or cells mutations. Okay, for example, like visible light. Okay, from from the light in our room. Okay, from the signals from our mobile phones, from radio wave. Okay, it's not a harmful one. Okay, the one that we should be worried about is the radiation we emitted from the uranium or X-ray. So, but we need X-ray, right? So we have to take some precaution to avoid the excessive exposure of X-ray. Okay, this is one example. Let's say you have one unstable molecules, so it will undergo a decay. Okay, to become smaller particles or wave. For example, like this uranium-238 is very unstable and will undergo a decaying process. Will produce alpha, gamma ray, and all these things as well, and the neutron, proton, and beta. The electron. Okay, so this is the radiation product. Okay, so from this slide you can see there are two types of radiation source. Okay, the from background or medical. Okay, so for medical, I think you are very familiar with all these terms, occupationals. Okay, computed tomography, CT scan, the one they use in cancer management for radiotherapy, nuclear medicines, interventional fluoroscopy, and conventional X-ray or radiography. Okay, so for background comes from space. Okay, well, if you are traveling to Turkey using an aircraft, okay, you are exposing yourself to the background radiation, but don't worry, it's not very dangerous. Okay, radon and turon. Okay, if you happen to come across an article, you might see radon and turon is can be found mostly at the area of Johor, Segamat, if I'm not mistaken. You can read it further. Okay, so this is the law. Okay, so this is the kitab, the holy book of X-ray legislation in Malaysia. Okay, I just want to show you this slide. Okay, just to get you familiar with. Okay. As I mentioned before, as other lecturers mentioned over and over, we all know that the X-ray will cause cell damage. Okay, so because as a dentist, you will expose yourself to the radiation over and over time. Okay, so you need to take some precautions. Okay, so we need to put some sort of so-called PPE, because why? We want to minimize radiation. We cannot totally omit the radiations, but we can minimize the doses of radiations, not only to patients but to other people as well. Okay, so we have to provide all those people with adequate protections. Okay, so what is your responsibility? Okay, as a dentist, or maybe in future as the owner of clinic, you have to to make sure your X-ray treatments comply with the regulations or requirement. Okay, and you have to make sure your working area is safe. Okay, that's meaning that you have to make sure the X-ray produced in the X-ray room, it doesn't leak to other area as well. Okay, it doesn't go or leak into the other surgery or other waiting room, because it will cause problems in the future. Okay, so we have to come out with the SOP. And nowadays, many people talk about SOP. Okay, especially during the IV. So to work with the X-ray, you must also come out with SOP. Okay, and when you have done all those kind of things, you have to make sure your equipment functions properly and undergo a regular maintenance process. Okay, and you have to make sure whoever operate the equipment, they must be well trained. Okay, if you're the only person who have a proper training, you have to train your staff. Okay, but in UC we don't have to worry because our radiographer, Mr. Malvin and Al Hafiz, they are very well trained. They have a diploma in radiography, so no worries at all. Okay, so below this atomic energy licensing at 1984 in bracket 304. Okay, there are many X as well. Okay, this 3X. Okay, you just have to know. You don't have to Google up and memorize all the content. If you are owner of a clinic, or if you work as a yang menjaga for government clinic, you should get yourself well versed with all these acts. Okay, because usually the audit will ask you about this. Okay. Okay. So how to establish a good X-ray area? Okay, can be with very specific room. Okay, or can be your dental surgery as well, or examine room. Okay, if you cannot afford to create or establish a special area for X-ray use. Okay, but let's say you use your dental surgery or examination room, you have to make sure there's no other dental procedure is at the same time as well. Okay, you want to take an PA of 1-1, you have to make sure other people who are not related to the X-ray taking process, you have to make sure they are out of the room. Okay. Okay, so what are the dimension requirement? Okay, at least for example, for PA should be 2 meters by 3 meters for intraoral, and for at least 2.5 meters by 3.5 meters width for extraoral. But usually to be safe, okay, we just make sure your room at least 2.5 by 3.5 meters. It's okay because okay, maybe just have started or just open up your clinic, you only can afford to provide intraoral X-ray, but in future, definitely in future you will upgrade your clinic to provide a better service. Okay, to provide a specialist treatment such as orthodontic, so you need to have this extraoral X-ray room. Okay, I'm very sure all of you guys have seen panoramic and spirometric X-ray, right? Okay, I don't have to show it in my slides. Okay, so shield, okay, the one that you put on your body, on the chest, on the neck, should have a thickness at least 1 millimeter slit equivalence for intraoral. For X-ray, 1.5 millimeters lead equivalence. Okay, so the one that we have in the level 17, I'm sorry, it has 20 millimeters thickness of barium plaster also inside, which is equivalent to 5 millimeters of lumber. Okay, I think this is more than enough. Okay, so beside X-ray rooms, okay, beside the X-ray equipment, all the film, so you need to come up with the safe working area as well. So those who are familiar with the hospital environments, okay, who have experience at a ward admission, I think you are very familiar with these lights, right? All those lights outside the machine room, outside the X-ray room. Because why? Usually, if the light is on, that means somebody is taking X-ray inside the room, and you should be careful. You should stay away from this door. Okay, because I'm very sure the wall. They have put something onto the wall to avoid the leakage of the radiation, but who knows? Okay, so you should be away from. You should put yourself away from this room. Okay, just to make sure the light is on, just to make sure you shouldn't get into the room. Okay, don't worry, your turn will come later. Okay, so this is our room. Okay, you can see because for extraoral, for intraoral, we usually we control from outside. We have not mistaken. Okay, we have this light. Okay, so for CBCT, after we have ensured the patient is positioned properly. Okay, after you have ensured all the gels, all the rings have been removed. Okay, it is the time to take the CBCT. Okay, you should be outside the room, and from through this window, you have to ensure just before you press the button, everything is okay, and then press the button, and you will hear some kind of sound. Okay, so once the X-ray taking process is over, the sound will stop. Okay. Okay, so what you can do if you're working in the area which has now a specific dimension, like I mentioned in the previous slides. Let's say you happen to I mean to work in the area like what you can see in the slides. Okay, usually like in the emergency department. Okay, because as a dentist you need to do on call, right? Okay, and then in the emergency department they don't have a specific room for a dental X-ray. So what they can provide is the panel with glass at the center, and then the apron as well, the lid apron. Because why? Sometimes of course the END, emergency department or casualty, you cannot walk. Patient cannot walk. Okay, especially those who have major trauma to the face or to the limbs, they cannot walk. So what happened? They will bring over the portable X-ray machine. Okay, this is the more example. Okay, so now we come to the SOP. So the written instruction or SOP should be visible and always available and displayed near the X-ray equipment. Okay, so that everybody will be able to see it. Okay. In the SOP or written instruction should be a statement of responsibility of personnel. Okay, how to position the operator and patients. Okay, how to use the prosthetic device properly, your aprons or your collar. Okay, or your locator. Okay, and how to position your beam or direct your beam properly, and then how to monitor the persons. Okay, if you want to know if the person has been exposed more than what it should be, you have to provide that kind of thing as well. Okay, so as I mentioned earlier in the previous slides, so the lid apron should not less than 0.05 millimeters. Okay, especially for reproductive organ protections. Okay, for children, they should wear a tetanus shield, especially if you want to take the postal radiographics X-ray. Okay, so and protective apron for healthcare provider. Okay, who also to the person who provide assistance to doctor to position the patient as well. Okay, so the apron shouldn't be folded, and then should be stored properly, like in the picture in the slide. Okay, so in terms of patient positioning, the beam shouldn't be aligned and shouldn't be directed towards the patient reproductive organs. Okay, you have to be careful, especially when you are taking occlusal view from the maxilla. Okay, so and you should be conscious as well. If your suspect patient is pregnant, you should ask. Okay, but please ask in the proper manner. Okay, for example like Cik dah berkahwin ke? Okay, dah berkeluarga? If yes, Cik pregnant ke? Okay, that should be the way, not like ngandung ke? Yang itulah, it's not very ethical. Okay, and then you have to use film holder to in order to assist you to beam, okay, to direct the beam properly onto the tooth that you want to investigate. Okay, it's very useful. Okay, if you don't have the film holder, then you can use your thumb, not your thumb but patient's thumb. Okay, if patient cannot position the X-ray because you don't have any holder, or patient itself is very weak, okay, the health condition doesn't permit him to do so, you can help patient to position using your thumb, but you have to put on your PPE, okay, for X-ray. Okay, pulsar radiation monitoring device, okay, usually will be put on by the radiographer. Okay, so it's kind of small badge put on the shirts or their attire. Okay, so those people who should wear this is those people who are exposed to the X-ray radiation more than 1 millisievert in 1 year. Okay, or with a weekly workload that exceeds 100 or 50 films per week. Okay, this is the example of the monitoring device. This is the holder. Okay, if your suspect patient is pregnant, you should ask properly. Sometimes they are not pregnant, they're just obese. Okay, so please be careful. Okay, so we have done with the apron, we have done with the SOP. Okay, now we comes to the maintenance. Okay, sorry. So the performance test will be carried out by the assigned body, which is by accredited class H consultant, so usually medical physicist, okay, which has class H license issued by the DG of Health of Malaysia, or Dr. Noor Hisham. Okay, so for the image receptor, processor, and viewer, okay, it is encouraged to use faster intraoral films. Okay, because for slower than E, you need more exposure to achieve good results. Okay, faster film requires only minimum radiation exposure to see the good results. Okay, always remember this principle. Okay, so for automatic processor, it should be clean and maintained from time to time. Okay, and also the same principle also apply to the manual processors. Manual processor. Okay, I think all of you has no luck to see this kind of manual processor, but during my undergraduate time, we used this. Okay, we have if I'm not mistaken, we had developer, Walter, fixer, and water. Okay, and then we should wait maybe for 1 or 2 minutes in order to see the results. Sometimes we mix up with other X-ray as well. Okay, and alhamdulillah, during your time we have automatic processor, digitalize some more. Okay, so you can alter all the image, we can manipulate the image with the digital version. Okay, and then you as a boss, okay, you have to make sure your staff have adequate training in terms, especially for radiography taking. Okay, so for government is a must. Okay, so you have to make sure the operators or radiographers must understand all the guidelines and requirements, okay, and the person should be able to detect any hazard. Let's say it happens, we don't know, it can happen anytime. Maybe we are in the wrong person in the wrong person in the wrong time at the wrong place, okay, we're not sure. So we have, I mean, he must make sure he understands the self-working methods, okay, and then eliminate the unnecessary things, okay. The things we shouldn't be done, you don't have to do. Okay, for example, let's say you take a PA of 6 months ago, okay. Not 6 months, it's too much. Maybe 2 weeks ago, okay. So you have passed your patient to your friends, and patient want to investigate the 1 as well. So if patient doesn't have any symptoms, any problems since the day you took the X-ray, just use the same X-ray, just use the same PA. You don't have to take new one, unless after you have taken the PA, patient has other complaint. Patient complain of broken tooth, or patient had abscess or swelling on the gum. Then you need to take a new one. Perhaps something has changes has taken place inside the bone, or the structure inside the bone. I mean, the root of the 1 has altered or has changed. We don't know. For that kind of things, we can take a new X-ray. Okay, and then you have to take care of your staff as well. Okay, if your staff happen to be pregnant, so you just inform you, and you have to assign her for better work, okay, which doesn't require exposure to the X-ray, towards the X-ray. Okay, so in terms of quality assurance, we take an X-ray with this kind of principle. Alara, it's like the name of the goal. Okay, so as long as reasonably achievable. Sorry. Okay, so now how to minimize the exposure. Okay, the equipment should be operated by trained personnel. Okay, so the area or room shouldn't be used for more than one radiological investigation at the same time. Meaning that if you want to take a PA for one patient, that's the only procedure that can be allowed to be operated at the same time. You want to take another person to take another X-ray, for example, like OBG, okay, you have to wait for your turn. Okay, all person except for the patient and the assistant should leave the room. Okay, when the radiographic examination is in process. Okay, so you have to keep yourself as far as you can from the primary radiation beam. Okay, and all the operators should use the protective devices, aprons, okay, and then a film holder, thyroid collar if necessary. Okay, and you have to make sure the X-ray equipment should be controlled from outside. Okay, if not possible, should be from behind the protective screen. Okay. You make sure you have to try your best, okay, to make sure the film is held by the holding device, okay, or held by patient, not the operator. Okay, if you patient require assistance from us, you have to put on your protection, okay, but it's not encouraged to do that. Okay, and then the X-ray tube shouldn't be held by the hand during your operations. Okay, to minimize the unnecessary exposure to unnecessary area. Okay, again, you have to avoid unnecessary radiological examination. You just want to take PA11, just take PA11. You don't have to, I mean, you must not take PA of your fingers. Okay, that's the rule. For suka is also not allowed. Okay, so protect yourself. I mean, not only yourself but patient as well from excessive radiations. Okay, so let's say the dose is for PA of 22. Just go ahead. Okay, don't do you want to take PA of 22 but use the dose of PA for molar. It's not a very kind action. Okay, it's very unethical. Okay, so radiographic examination is for Denniston only, not for suku as well. Okay, you want to make a joke with your friends, you want to take X-ray for kenangan for your Instagram post, it's not allowed. It's very unethical. Okay, so routine or screening examination without prior clinical assessment should be avoided. Let's say you want to patient is complaining about the pain only 1-1 dah bosan sangat for 3-3. Okay, before you send for the X-ray, you should examine clinically first. You have to observe, okay, see what is going on. Okay, you have to examine clinically by palpations and percussions of the tooth. Then proceed with the X-ray. Okay, don't straight away take the X-ray before you do any clinical examination. Okay, and then let's say you are not satisfied with the PA of T3. Oh, it's look darkened a bit. Okay, you are not satisfied because you are perfectionist. Okay, you only post perfect picture on Instagram. But the same thing cannot be done with the PA. If you think you're still able to see the things they want to see on the below quality of radiograph, just go ahead. No need to take a new one. Okay. So sometimes we need with your suspect patient is pregnant, you should ask. Okay, sometimes the patient is not aware. They themselves are not aware they are pregnant. Okay, you as a doctor, you have some knowledge. You should assist them. Okay, so put on the lid apron. Okay, and then as I mentioned earlier, the primary beam shouldn't be directed towards the reproductive organs, so or unnecessary area of the body. Okay. Okay, now we come to the radiation doses. Don't get confused. For radiation doses, it's not like calculating doses for medicines. Okay. So we have to try out doses. Okay. For example, like you are exposing yourself to the sunlight. Okay. So how to calculate the dose of the sunlight exposure to your skin? Okay, the exposure effect will depends on the intensity of the light or the sunlight, the length of exposure towards the sunlight, as well as sensitivity of the skin. Okay, I mean, how to know the side effect of the sun exposure to your skin will depends on all those three factors. Okay. So let me explain what the absorbed dose, equivalent dose, and effective dose are. I'm sorry. Okay. For absorbed dose, it's like concentration of energy that deposited in tissue as a result from exposure to the ionizing radiations. Okay, because X-ray, unlike sunlight, it can penetrate deep into our body. Okay, well, the equivalent dose is an amount that takes the damaging properties of different types of radiation into account. For example, let me compare between the absorbed and equivalent dose. Okay, for absorbed dose, it will tell us the energy which is deposited in the volume of tissue or body. Okay, whereas the equivalent dose will address the impact that the type of radiation has on the tissue. Okay. But differently, the effective dose is used to calculate value, which is usually measured in millisievert, that take three factors into account. Okay, it is used to measure the whole effect of the radiation exposure to our body. Okay. So, like the quantity of effective dose will help us to measure a few things, such as, for example, different body parts have different sensitivities towards radiations. Okay, so the head the head is less sensitive than the chest. Okay, so for example, for the city of Daman, okay, if somebody is asking you about what is the dose of relation towards the abdomen, I mean the dose of CT scan, okay, you can't answer, okay, the CT scan dose is 20 millisievert. If you want to answer that kind of question, you have to answer based on these following doses. For example, the typical absorbed dose is 20 milligray. Okay, the typical equivalent dose is 20 millisievert, and the typical effective dose is 10 millisievert. Okay, so I hope that my explanation helps you to understand more. Okay, if you still don't understand, you can ask me personally. Okay, you can DM me or you can PM me at any times. Okay, I will reply as long as I don't sleep. Okay, so for example, like the effective dose of two bike wings E-speed films, okay, in order to achieve this 0.002 millisievert, you have to expose to the natural background radiation for 8.8 hours. Okay, so what I'm trying to explain is the dose which is produced by the X-ray machine and how to achieve it by exposing yourself to the background radiations. Okay, how long you should be exposed to achieve this the effective dose for the X-ray that we are using in our clinic. Okay, for example, like OPG, independent aerobic, using a calcium tungstate screens which have effective dose 0.014, you have to expose yourself to background radiation, maybe in the to the space, okay, by exposing yourself for 2.6 days, maybe 2.5 days, I'm not sure. Okay, for extraoral radiograph, okay, which is, I mean, the effective dose is higher. Okay, for example, skull radiograph 0.1. Okay, so how to achieve this dose? Okay, you have to expose yourself for longer periods compared to the this intraoral. Okay, you have to expose yourself for 2.6 weeks. Okay, so don't worry, even though we have background radiations, it's not as as nasty as the one that we use in medical field. Okay, for example, effective dose for flight from Melbourne to London, transit at Singapore, which has effective dose 0.065 millisievert, you have to expose yourself towards the background radiation for 12 days. Okay, I hope you guys understand. Okay, so I'm very sure that you guys are very familiar with this professor. Okay, there's such controversial between the dentists and our medical counterparts regarding these issues. Okay, as a conclusion, for pregnant lady, you have to postpone any elective procedure, especially in the first trimester, especially for X-ray exposure, because why? During the first trimester, the organogenesis is taking place. Okay, with all the limbs, the organs formation is taking place. Okay, and then the best period is to take X-ray or to provide a dental treatment towards a pregnant patient is during the second trimester, but try to avoid the unnecessary exposure of X-ray. Okay, and you also need to why the second trimester is the best period to provide a dental treatment, because if you want to do the first trimester, you have to consider the organogenesis process. Okay, the third trimester, the fetus getting bigger. Okay, is comprising the inferior vena cava, Okay, if patient is lying on the right side, it's comprising the superior cava will cause a less venous return to the cardiac and less cardiac output. Okay, and then patient, I mean, we care about the mother's conditions. So the best period for dental treatment is the second trimester. Okay, but try to avoid X-ray if it is unnecessary. Okay, but if it is necessary, required for urgent case, okay, by any means, you just proceed. Okay, okay, okay. So this is the effective dose for I mean the limits of the effective dose and equivalent dose in the those who work in the health sector, for example, like radiographer or in the public. Okay, so for effective dose, this is according to the Australian guideline. Okay, Australian New Zealand guideline. Okay, for those who work in the health sector, for radiographer, the effective dose limit is 20 millisievert per year. Okay, which is averaged for a period of 5 consecutive calendar years. For public, only can afford 1 millisievert, okay, per year. Okay, for equivalent dose, okay, I hope you understand the definition of equivalent dose that I told you before. Okay, the for less of the eyes, 150 millisievert as in fit 500, but for public, of course, the dose should be lesser than those who work in the health sector. Okay, 15 and 50 millisievert. Okay, so if you have any questions, you can always ask me. Okay, maybe perhaps WhatsApp as well as in MS Teams. You can DM me, and then this is the guideline that I used during preparation of my lecture. Okay, thank you guys.